Assalamu alaikum. Today I'll be talking about anatomy branch of the respiratory system for foundation year. Okay, so let's begin. So we can tell that here is lungs, and the respiratory system is divided into two parts, upper and lower. So the upper respiratory system is from the nose to the larynx. So you can see if I can. Okay, no. Okay. So it's from the nose all the way to the larynx, and the larynx and below is called the lower respiratory. So larynx is included in the lower. Okay. Move on. To the nose. Okay, so the nose is split into two parts: the external portion and the internal. Divided into two parts: the external and the internal portion. Okay, so let's talk about that. So first of all, we'll talk about the functions of the nose. So the nose provides an airway for respiration. Okay. It moistens and warms the incoming air, and it finally filters and cleans inspired air. Okay. It also serves as a resonating chamber for speech, and houses the smell receptors, the olfactory. Okay. So you can tell from the surface anatomy that we have the root and bridge of the nose. The root and bridge of the nose are made from the frontal and the nasal bones. Okay. So the root is above the bridge, and we move on to the dorsal nasi, so this part of the nose. It's made from the nasal bones again, okay? And lateral to those is the ala of the nose, okay? Finally, the nose ends at the apex, okay? And the cavities that go into the nasal cavity is called the nares, or the nostrils, okay? We can tell the borders of the nose that superiorly, the borders of the nose superior is nasal and frontal bones. Laterally, you have the cartilages of the ala, of the septal cartilage, and the alar cartilages. And inferiorly is laterally it's the maxillary bones, and inferiorly it's the alar and septal cartilages. Okay? Do you need to explain any of these? It's all memorization. You just need to know it for the exam. Okay? So I have a question. Which of the following is not a function of the nose?
B.
Okay, so yeah, B. What initiates the cough reflex?
Trachea.
Come again?
Trachea.
The carina, the last tracheal cartilage. That triggers the cough reflex. So again, we know that the functions of as I explained before, provides an airway for respiration, filters and cleans inspired air, and moistens and warms air. What else does it do? There were five functions.
Resonating chamber for speech.
That's correct. There's resonating chamber, and what else?
Epithelium for smell.
Epithelium for smell. Okay. Move on. What type of epithelium lines the nasal cavity? I didn't explain this, but you should know it.
B.
B. Correct. Pseudostratified ciliated columna. Okay. The cilia moves in which direction?
Towards the pharynx.
That's correct. Towards the pharynx or towards the throat. That's what to hear when we clear the throat, for example. We help the nose clear out the mucus and the debris. Okay. Pseudostratified ciliated columna. Move on to the nasal cavity. Okay. So the nasal cavity is divided by midline nasal septum. Okay. Nasal cavity is divided by the nasal midline septum. That's usually that can be deviated, for example, and at that point you'd have one blocked nose and one working nose. We'll move on. Anteriorly, it is formed by the septal cartilage, and posteriorly, it is formed by the vomer bone and the perpendicular plate of the ethmoid bone. Okay, this was written in your book, but it's not explained in the pictures. I want to point out a thing. What's the different name for the posterior nasal aperture?
Choanal.
The choanal. Okay. Do not confuse it with the concave. Can someone tell me what's the function of the concave?
It's like increases the surface area.
It's the projections out from the lateral walls of the nasal cavity. It's to what was its function?
Increase surface area and moisten the air.
It's increase surface area and cause turbulence to slow down the air and humidify it and warm it up. Okay. Again, this is a picture that you must memorize for the exam. Usually they don't ask questions about the anatomy. You just expected to know this. For example, if someone tells you what part or structure is deviated or broken. For example, if you have a broken nose, what would be broken? The nasal cartilage, for example. Okay. We'll talk about the sinuses. We have 4 sinuses. Can someone name them?
Sphenoid,
We have the sphenoid,
frontal,
the frontal,
maxillary,
maxillary, and what was the last one?
ethmoid.
Ethmoid, correct. So what's the function of the sinuses? It's also continuation of the nasal cavity, so it's to moisten the air and humidify, and to also lighten up the skull. We have a homeostatic imbalance in your book. Can someone remind me of it?
Sinusitis.
Sinusitis. So when you have sinusitis, for example, you get headaches and pressure changes, right? So when you tilt your head forward, you'll have pain, okay, and you feel like your head is heavy. Okay. We talk about the respiratory mucosa. So the respiratory mucosa is made from pseudo-stratified ciliated columna, okay, and contains also goblet cells. These goblet cells rest on a lamina propria that's richly vascularized. That's why you have a lot of nosebleeds, or they're common, okay, and it's usually secretes 2 types of secretions. Can someone tell me them? The defensins and the mucus. Okay, so the mucus is trapped debris, and the defenses is antimicrobial. So we will even talk about the nasal mucosa. So the respiratory mucosa is pseudo-stratified ciliary columna again. It contains goblet cells and is raised on richly vascularized lamina propria. It contains a lysozyme, so that's the one I forgot, an antibacterial and defensins, an antibiotic. Okay, so cilia moves debris towards the throat, so the larynx and the pharynx, and nerve endings and mucosa trigger sneezing. This, for example, when debris gets caught. Move on to the pharynx. So the pharynx is divided into 3 sections. So the nasal pharynx, the oral pharynx, and the laryngeal pharynx. Okay. Can someone tell me the epithelium found in the nasal pharynx?
Pseudo-stratified ciliated.
It's a continuation of the nasal cavity, so to contain pseudo-stratified ciliated columna. Okay. It's continuous with the nasal cavity again, and it goes through a aperture, the posterior nasal aperture. Also, another name for it is rachoni, as I mentioned before. It houses 2 tonsils. What's the function of a tonsil?
Kills bacteria and protects the body.
Okay, so it kills bacteria and protects the body, as again your colleague said. It houses white blood cells and kills the bacteria, engulfs pathogens. Okay, so we have 2 pharyngeal tonsil, also known as the adenoids. Okay, and you have the tubal tonsil. The tubal tonsil is for your inner ear. In case if an infection occurs in the nasal cavity, it does not spread to your middle ear and your inner ear. Okay, and this is the pharyngeal tympanic tube that's surrounded by the tubal tonsils. What's the function of pharyngeal tympanic tube?
Equalizes the pressure.
It equalizes the pressure in your ear. So it's a connection to your middle ear. Okay, so let's move inferiorly. We move on to the oropharynx. The oropharynx is continuous with your mouth cavity. There houses 2 tonsils, the palatine tonsil and the lingual tonsil. Okay, so here the epithelium actually changes from what to what? Can someone tell me?
From ciliated pseudo-stratified into stratified squamous.
That's correct. So move on from pseudo-stratified ciliated columna to stratified squamous. This is because now air and food enters your body. Usually in the nasopharynx, only air enters. Okay. Also, there's an organ, ovula. You know what's the function of the ovula? It's to block the nasopharynx from having food enter or liquids when you're drinking. Okay. This reflex is triggered automatically, but when you're unconscious, it's not triggered. So it was recommended in your book to not administer liquids to unconscious people. Okay. Move on to finally to the laryngopharynx. Okay. Laryngopharynx is the continuation of our pharynx. The nasopharynx goes down to your larynx with an opening to your esophagus and larynx with the controlling of the epiglottis. Okay. Which part of the pharynx serves only as an air passageway?
C.
Nasopharynx. That's correct. Okay, so the rest, oropharynx, laryngopharynx are what were their epithelium? Stratified squamous. It houses both air and food. So it's supposed to protect from harsh chemicals such as spiciness. That's why it's stratified. Nasopharynx is ciliated, so stratified, that only contains air passages. Okay? Epiglottis is a cartilage, has nothing to do with this. Move on to the larynx. So the larynx starts at the third cervical vertebra and ends at the sixth. Its function is to provide a patent airway, okay, and act as a mechanism to route between food and air tracts. That's the epiglottis' function. It also houses your vocal cords for voice production. It has 9 cartilages, all of which are hyaline except the epiglottis, which is elastic. Okay? So stratified squamous epithelium lines the superior portion of the larynx until you reach the vocal cords or the vocal folds, which it turns back into stratified ciliated columna. Okay? This time the cilia, instead of pointing downwards towards the throat, is pointing upwards towards the throat. Okay? The Valvasa maneuver is used to stabilize the body. It's when you close the glottis and hold pressure in the body trunk. It's used to stabilize the body trunk and empty the bowels. Here's a picture of the larynx. Okay. So I just want to say that the epiglottis extends from the posterior aspect of the tongue all the way to the anterior rim of the thyroid cartilage. And we have 9 cartilages here. For example, you have the laryngeal prominence or the Adam's apple of the thyroid cartilage. That's an important structure. It's attached both to your hyoid and to the cricoid. Okay. We have also 3 triangular shaped cartilages. You have the cricoid, the coronacate, and the arytenoid. Can someone tell me which one of these are the most important?
I don't know.
What's the function of the arytenoid?
Vocal.
Or vocal cords, that's correct. Okay. So the vocal cords attached vocal ligaments which are attached to the arytenoid. These ligaments, composed of largely elastic fibers, make the glottis. Okay, so you can see here with the vocal cord is glottis. I'll show in the picture with this one. Okay, its main function is to produce sound. Okay. We also have the vestibular folds directly above it. These have no function in the vocal cords. They're called false vocal cords, and their function is to just close the glottis. Okay, laryngitis is when you have voice hoarseness. It's when your larynx is inflamed. It usually causes us to whisper and have hoarseness in the voice. Okay. Move on. What is the primary function of the epiglottis?
B.
B. Prevents food from entering the lower respiratory tract. That's correct. Okay. And which structure vibrates to produce sound?
C.
C. The vocal cords. Correct. Okay. Move on to the trachea now. So we have entered the trachea. Here is the posterior and anterior. The anterior is covered by hyaline cartilage, and the posterior border is covered by the trachealis. So as you can notice, the trachealis is smooth muscle and it's all flexible. Why is that?
So if food enters the esophagus, it can expand a bit and kind of protrude into the trachea.
That's correct. So food can expand anteriorly. So the esophagus can expand anteriorly when the food is present. Okay. We have the mucosa, which is made from pseudostratified ciliated columna and the lamina propria. Okay. The submucosa is below it, deep to it, and produces the sacromonious glands, which produce the mucus that we all know. Okay. Hyaline cartilage again borders the anterior portion, and adventitum borders the hyaline cartilage. Okay. So a function of the cilia, again, as I mentioned, needs upwards to clear out the throat. But when you smoke, for example, the cilia's function is disabled or ultimately destroyed. So what happens is that we have to cough to clear out the mucus every day. That's why we have the smoker cough. Okay? And again, I'll mention it later on, the carina. The carina, the last tracheal cartilage, contains sensitive nerve endings that trigger the cough reflex. When something gets lodged in, or liquids, for example, get lodged into the trachea. Okay? We will be talking about the lung, the left lung and the right lung. So the left lung is split into 2 portions, we know it, or 2 segments. The inferior lobe and the posterior lobe by the, what was it called, the fissure?
Yeah, the oblique fissure.
The oblique fissure. And we have 3 lobes in the right. Well, there are two fissures split them. What are they called?
Horizontal, oblique.
Horizontal and oblique, that's correct. Okay? We have an indentation here for the heart. We'll move on to later. We'll talk about that later on. So the trachea divides to form the left and right bronchioles, or bronchi, approximately at the level of T7. Okay, the right bronchi is wider and shorter. That allows more objects to get stuck in it. Okay, so we'd have questions, for example, that a child swallowed a peanut. Okay, we have it coming up. That means, and usually that means that the right bronchi will have that peanut found in there. Okay, as I again said, three lobar segments are found in the right lung and 2 in the left. Okay. So as the bronchi divide, the cartilages ring that surround the bronchi gets narrower and narrower until it's replaced with regular patches of cartilage. Okay? And bronchioles do not have cartilage, which is the end product when we're trying to exchange gases. Elastic fibers are present throughout. Move on. The epithelium changes slowly from pseudostratified columnar to simple columnar to simple cuboidal. And smooth muscle increases. We need the constriction at the end to increase the resistance for certain functions, such as when we're exhaling air. The mucosal epithelium thins as it changes from pseudostratified, okay, then to simple cuboidal in the terminal bronchioles. So simple cuboidal is found in the terminal bronchioles. Most airborne debris found at or below the level of bronchioles must be removed by macrophages because again there's no cilia, there's nothing to sweep it upwards. So here we have the alveolar duct, we have the terminal bronchiole that moves on to the respiratory bronchioles that move on to the alveolar duct. Can someone tell me the difference between the alveolar duct or the alveolar sacs and the alveoli?
The alveolar sac is a bunch of alveoli.
So the alveolar sacs is a collection of alveoli. You can see also that the elastic fibers are present, the yellow lines around the alveoli. Okay, and the alveolar duct is the alveolar duct is the final thing that connects respiratory bronchioles to the alveoli. So I'm mistaken. Okay. Go on to the respiratory membrane. So can someone tell me the anatomy of the respiratory membrane? What is it composed of?
The alveoli and the capillaries and their basement membranes that are fused together.
That's correct. Okay. So you have the membrane of the capillary, the membrane, the basement membrane of the alveoli, and the alveoli itself. Okay, and the alveolar wall. That makes the respiratory membrane. It's also called the blood-air barrier. So most of the alveoli is made out of simple squamous epithelial cells. So this is called type 1 alveolar cells. We have also type 2, which is cuboidal and secretes surfactant. Can someone tell me the function of surfactant?
Decrease.
It's written here.
Reduce surface tension.
Yeah. So it reduces surface tension. This will be covered later in the physiology part. Okay. We also have macrophages that consume debris, and gas exchange occurs by simple diffusion. This is all known, common, everything so far is clear. So terminal bronchioles feed into respiratory bronchioles that feed into alveolar ductal. Alveolar have two significant features. Okay, they are surrounded by fine elastic fibers, as I mentioned before in this picture, the yellow lines. Okay, and open alveolar pores are present to allow for the pressure to normalize between each alveolar sac. So, for example, if your lung gets ruptured, it gets normalized. Or if a part or a lobe gets stuck by debris, that also gets normalized with the rest of the lungs. Okay. Here we have the basement membrane. We can see that the blood-air membrane is here, with simple diffusion exchanging carbon dioxide out into the alveoli and oxygen in. So far, so good. This is self-explanatory. You just look at it, you'll understand. Do you have any questions? No? Okay. So which cell secretes surfactant in the alveoli?
B.
Okay, so B, type 2 alveolar cells. Okay. Move on to the lungs. Okay, so this is the gross anatomy. We have the four borders actually. So the anterior, lateral and posterior borders, what are these called? The costal surface of the lungs. Okay, the right lung is again segmented to 3 lobes with the horizontal fissure and the oblique fissure. Okay, their left lung has a cardiac notch on the medial sternum side. Both of them have the hilum. Can someone tell us the hilum's function?
It houses the root, and which is like the bronchi and the arteries, the veins, everything just goes in there. Into the
So
lung.
your nerves, your veins, your arteries all run through your hilum, which is called the root. The collection of the veins and vessels and arteries is called the root. Okay. Your heart, the apex of the heart towards the left side. That's why I have an indentation in your left lung. Okay. Here you have the root itself with the hilum. Okay. Self-explanatory, just pictures. Okay. Each segment is served by its own artery and vein. We all know this. Okay. The left lung is subdivided into superior and inferior lobes. The right lung is divided to right superior, right middle, and right inferior. The medial stem called the. Okay, we already talked about this. We move on. So it's a different picture. This is the anterior. This is what plane is this?
Horizontal.
The horizontal or the transverse? Okay. So we already talked about this. There's nothing really self-explanatory. Okay, we move on to the lobules or the segments of the lungs. So the right lung has 10 segments, which is always fixed, and the left is variable from 8 to 10. Yeah, that's it. You know what the segment is, correct? The little triangular spaces that are usually blackened by smoke in city dwellers and smokers. Okay, each segment is served by its own artery and vein. Okay, that's it. Each one is separated by by connective tissue septa. That's all that you need to know. Okay, we'll now move on to the circulation. Slides open. Move on to the circulation. Okay, so you know that arteries and veins are swapped in the lungs. So we always know, think about it. Whenever away from the heart is called arteries, and towards the heart is called veins. Okay, so in the systemic venous blood that is to be oxygenated is carried by the pulmonary arteries. Okay, and the fresh oxygenated blood is carried away by the pulmonary veins. Okay, the exchange at the alveoli, that's the exchange shed. Okay. The pulmonary circuit is a low pressure, high volume circulation. Your entire blood volume goes through the lungs in 1 minute. That's okay. The lungs are innervated by the parasympathetic and the sympathetic. Can someone tell me what does the parasympathetic do? Constrict. And the sympathetic dilate. So both of them work in opposite. Okay. They form the pulmonary plexus. Okay. Parasympathetic vipers constrict again, and sympathetic dilate them. So inflammation of pleura. Do you know what the pleura is? I forgot to talk about this. So the pleurae line the lungs. Okay, we have the visceral, which attaches to the external portion of the lungs, and the parietal, which attaches to the thoracic wall. It's closely attached together, and serous fluid fills the cavity between them. So this allows the muscles of the thorax to expand and the lungs to expand with it. Okay? So we have something called pleuritis. Can someone tell me what pleurisy is? What's pleurisy?
Inflammation of the pleural membranes in the cavity.
And what are the symptoms? Pain, problem breathing, and eventually it will exacerbate to the point where there's a large amount of fluid to reduce the friction. At that point, you have difficulty breathing and shortness of breath. We use cardiac tamponade. No, not cardiac tamponade. We insert the hole to release the extra fluid. Okay. The term for fluid accumulation is called pleural effusion. Okay. I think that's it. Very short. You came in late. I'm sorry.